Hello, my name is Dr. Philip Miller. I'm a facial plastic surgeon in New York City specializing in rhinoplasty, and I answer questions daily sent to me at questions@rhinoplastymaster.com. Today's question is, what kind of anesthesia is used during rhinoplasty? Well, of course, and most of my answers are, it depends. It depends upon what is being done. But let's talk about a range of what is performed, a range of types of anesthesia that can be that you can have. On one extreme is general anesthesia, where a patient has a tube that's placed through the mouth and into the windpipe, and that's actually very safe. Some people think that's more invasive, and it somewhat is. It's more than the other extreme, if you will, but it's actually very safe, because when you're lying down, any collections, any fluids or blood that's draining from the nose goes to the back of the throat and could be inhaled as you're undergoing the procedure. So a tube that goes through the mouth and actually goes through the windpipe is very safe. It prevents any fluids from getting into the windpipe. From there, you have something called LMA, Laryngeal Mask anesthesia. That also has a tube that goes in the mouth, but it doesn't go through the windpipe, it sits on top of it. And just like an endotracheal tube, the first one I talked about, it prevents fluids from going into the windpipe. After that you have, or before that if you will, you have something called intravenous sedation. For those of you who have had a colonoscopy or perhaps even dental work, a molar being removed, you'll have an IV placed. You'll have an IV placed in all scenarios, but you'll have an IV placed. Liquid will go in, which will make you a little tired or a little sleepy. You'll not remember the procedure at all, and a rhinoplasty can be done under those situations. And then, of course, the most non-invasive is simply putting some medication on the inside of your nose to numb the nose, typically with a very few injections as well to completely numb the area so you don't feel anything. And then a small rhinoplasty can be had during those anesthetic situations. I have a micro-rhinoplasty. There's a video on micro-rhinoplasty where a patient had just a small little bump. That's what bothered her, and she simply required some numbing medicine with a Q-tip inside the nose, and she was fully awake and didn't feel a thing. And I have an instrument which just brings that little spicule of bone down and made it smooth. So which one should you have? Speak to your surgeon, speak to the anesthesiologist who is doing the procedure, and find out what you feel most comfortable and what is the safest for you. Please feel free to send your questions to questions@rhinoplastymaster.com, and I look forward to hearing from you. Have a good day.